On behalf of the Center for Communication in Medicine, I'd like to invite you to Coping with COVID-19, the lived experience of patients, loved ones, and healthcare providers. Speak Sooner webinar. I'm Bernard Bandman, Executive Director of the Center for Communication in Medicine, and I will be your moderator. We are all living in a time of worry and hope. COVID-19 has impacted our lives and has been a challenge to navigate. We are still trying to cope, but also we are very impatient on getting on with life. Many of us have followed the CDC guidelines to act safely and get vaccinated. Others that we know may be questioning masking and social distancing and hesitant to be vaccinated based on their beliefs about safety or other reasons. Others outright refuse to comply with these safety guidelines. So it is our intent to address these complex and timely issues by hearing from those who have had firsthand experiences with COVID-19. So let me introduce the panel. Jim Raposa contracted COVID-19 and was hospitalized at Southwestern Vermont Medical Center in Bennington. There's Jim. He'll share his experience as a patient. Jim is director of theater at Baker-Porazinski Academy in Manchester, Vermont, and a professional actor who has appeared on Broadway, TV, and film. Claudia Shell Raposa is Jim's wife. She served as his caregiver leading up to and after his hospitalization, and we'll talk about her experience. Claudia is director of dance at Baker-Porazinski Academy and is also a professional actor who has appeared on Broadway. Gretchen Martinez is an ICU nurse at Southwestern Vermont Medical Center. During this time of COVID-19, she's had to protect herself in a setting with very sick patients and safely care for her two young daughters and her husband, who is a cancer patient. Dr. Jennifer Baker-Porazinski is a primary care physician in Hoosick Falls, New York, whose husband, Paul, was seriously ill with COVID-19. She cared for him at home. At the same time, her 17-year-old son had COVID, while her two other sons were spared. So before beginning the program, moving into the panel, I'd like to remind all of you that you can submit your questions through the Q&A at the bottom of your screen, and I will do my best to have the panel answer as many of your questions as time allows. So, prior to the webinar, I asked a group of patients, loved ones, and healthcare providers, including those on the panel, to briefly describe their experiences. So what I'd like to do now is show you a video clip about what they had to say.
Surreal.
Unpredictable and pervasive.
Indiscriminate.
It was exhausting.
Scary.
Emotional.
It felt like a fog underwater.
If I was not there, like people that live alone, I thought that is really dangerous.
I feel highly susceptible to an infection that I don't feel I have a very good protection against. And I do run into the risk factors, partly because of age.
There were moments of sheer terror where I thought I was going to end up on a respirator, unconscious, unable to say goodbye to my family.
It just, you could hear the angst on people's in people's voices on the other end of the phone. When they were talking to someone, they had no idea who they were talking to, but yet we had to convey to them that they could trust us.
That I've talked to scared family members, but it's a whole different, unpredictable and pervasive thing when it happens in your own house.
So you've just heard some of what they've experienced. And now in this program, you're going to have a chance to meet them, and you're going to have a chance to hear more and more detail about their experiences, the lived experience. So what I'd like to do is like to begin with you, Jim. And can you tell us more about your experience of it being surreal? And also let us know what you actually experienced as far as the symptoms leading up to your hospitalization, and what was it like being in the hospital so sick?
Yeah, we can kind of pop up from surreal, because Claudia and I talked about this after we had talked with you that night. I came home, I think it was a Thursday night, and I just said, I'm going to bed. And I went to bed. I never really got out of bed. It felt, for probably 4 days, it was over the weekend, I canceled rehearsal. And I just would like get up, try to grab something to drink, something to eat, and I would immediately go back to bed. I just couldn't shake the being tired. And I slept a ton. And I started, and I think Claudia will say this, I wasn't eating well. I wasn't able to really take care of myself. I just kept sleeping. And I had some telephone conversations with the doctor, and I could not finish a sentence. I could not finish a thought. And I was in a fog the whole time. Claudia remembers more of it than I do when I was at home. I think the kind of kicker to her was when I was on the phone with the doctor and I said, I just can't do this anymore. I got to go back to bed. And that's when I think I was brought to the hospital that morning. Claudia brought me down. I'd gone down, I think, a couple of days before, and they thought I had pneumonia. And we took a test because I just wasn't shaking it. And then I went down the second time, and that's when they admitted me. And they just were like, yeah, you're going to stay in for a little while. And they popped me up to ICU. And I don't remember much in ICU. I remember sleeping for a lot. I remember the people who took care of me coming in and being incredible. And I have no idea if Gretchen was one of them or not. And if she was, thank you for taking care of me. It's hard to say what it feels like. You have no energy. You have no ability to take care of yourself. You're underwater. You're not making cognitive decisions and being able to make good decisions. And then even when you're in the hospital, I did my round with remdesivir, and I was in for however many days I was in. Even when I came home, that brain fog is still not lifted. That ability to become physically active as I was has not lifted. It's gotten better. And, I personally feel better since I've gotten the vaccine and had my second shot, and know that I am not, hopefully infecting anybody, but number two, that I'm somewhat protected from it. because much like everybody else on this panel, we work with young people. So we work with people that we want to make sure don't get sick. And you know, we want to, you know, I personally don't want to, you know, do no harm to others. You know, that's what was important to me. And I have no idea if I've answered your question.
Well, you have, and what you've also done, Jim, is really allowed a segue to Claudia, because as you've already pointed out, that Claudia was witness to much that your own memory of it is so vague. It just is kind of general fatigue, exhaustion, right? And the hospitalization was even vague in your mind. So this is the perfect time to really ask Claudia, right? Like, what did you do when he became so debilitated? I think Jim touched upon it. But the other part is, what do you think would have happened if you were not at home with him? You mute. Yeah.
So he came home from work, and we've been married for 28 years, and I have never seen this. He came home and just dropped everything, came into the garage off his motorcycle, boom, and got right into bed. I had, you know, he was just done. It's like he just hit a brick wall, right into bed. And the fever started, the chills, you know, not wanting to eat, the fog. I was trying to get him to eat, obviously, and then he lost the taste and stuff didn't taste good, but he wasn't really eating. He was sleeping around the clock. And just when he started losing, like, his thinking wasn't right. You know, we did go to the hospital about 5 days after he came in that night. We got tested on Monday, that Monday, but our results didn't come until Thursday. So we went to the hospital on Wednesday. They gave him something and released him. And then we found out, you know, he was positive. And so we went home and we had to quarantine, obviously, and all of our friends and were fantastic, and our school was fantastic, our community was fantastic, bringing food and all kinds of things to help us. But the thing that made me take him to the hospital the second time is Jimmy mentioned when he was talking to the doctor and he's sitting on the chair in the kitchen because he couldn't stand up. And I was listening and he couldn't even do it. He couldn't even carry on the conversation. I let me talk to the doctor. He said, I can't do this. And he went back in. And I talked to the doctor, got the oximeter, took his oxygen level. And I think it was at 52. And I'm like, we're going to the hospital now. Of course, and I just took him right in. And of course, they admitted him, I think it was 4.5 days or so. And once he got to the hospital, I knew he was in great hands. I knew that I didn't have to worry anymore. I knew the professionals there, the medical professionals, you know, knew what they were doing, were trained for this. And I knew that was a sigh of relief for me. But while we were home, and I was thinking and touching on Bernie, the point, you know, what if I wasn't there? And I know there's a lot of people that live alone, and are by themselves, whether they're older, they could be any age, really. And I thought, God, if nobody's with them and the thinking starts changing and they want to sleep a lot, that could be really disastrous. And because they don't know how sick they are, maybe they're thinking, oh, it's kind of like a flu, I'm going to sleep it off or something like that. And, you know, I'll be better when it runs its course in 10 days. And I'm thinking, that's not, COVID is not like that. And I was just thinking they could just lay there and that could be it, you know, and just not a good outcome. And so for people to really be in touch with one another and to check in, especially when people are alone, to really just check in, because I know, and then some people don't want to go to the hospital. And I'm like, Jimmy, we're going. And he just got into the back seat, and I thought he was going to sit up. No, and he just laid down. But yeah, for us to really check in on the people that are by themselves, it's really important, because once the sleeping and then your thinking goes, that's just a dangerous, dangerous situation. But, you know, as I said, the community, the medical professionals, you know, everybody was so fantastic. They really just showed up, you know, did their job or helped us out, left things on the porch and food and this and that, or BBA community or community where we live in our town. And the hospital was great. Everybody I talked to on the phone, the doctors, the nurses, they were all fantastic, gave great information. So I did not worry. I knew, as I said, I knew he was in great hands.
Good.
And I really have to say for Gretchen and Jennifer, wow, I can only imagine. I feel for you, but thank you so much. I talked about exhaustion, but I don't know exhaustion like you know exhaustion. And I thank you for treating all these people and all of us, really. Thank you so much. You saved us, so thank you. I thank you for that.
That's a perfect segue, Claudia, to asking them, right? So let me turn to you, Gretchen. Of course, as an ICU nurse, you cared for these very sick patients while their loved ones were unable to visit due to safety protocols. So what was it like for you, the position, your experience, being that person who is now caring for this very sick person and having then to communicate, talk with these family members who are worried, if not terrified?
Yeah, I think that was a huge game changer for a lot of us that practice, especially inpatient medicine, where family is really so important in patient healing. And family is so incredibly helpful to the doctors and to the nurses, because they know the patient way better than we do. And especially in our small communities, a lot of times families there 24/7. And that just went completely away for all of us. And then we were dealing with something that nobody knew anything about. And it was scary for patients, it was scary for family, it was scary for us as providers, I think, at times. And I just tried to remember that for patients like Jim and for family like Claudia that were home, I became their eyes and their ears. I felt like we had a responsibility to be hopeful, but we also had a responsibility to be honest, because this was scary and things changed so very fast for a lot of the patients that we had. But family would call and they would have lots and lots of questions, and sometimes you just have to go through it over and over and over again, because it was the only way that they could have contact a lot of the times, because patients, especially as Claudia and Jim were saying, were just too sick to really give an idea as to what was going on. And it definitely changed my perspective and appreciation for how important it is to have family and friends there, and how isolating it can be for patients to be in a room with nobody that they know, and they have to trust us, and then we have to convey that trust, back to the people on the other end of the phone.
Well, this is what I'd like to now turn to you, Dr. Baker-Porazinski, because you had and have had the experience of caring for your patients with COVID in your practice and your own husband. So what was it like for you in finding yourself in that kind of dual role, one hand in your practice, and then your husband, and you've said, Paul was very, very sick. What was that like?
Well, first off, I am super grateful to people like Gretchen and to the nurses in the ICU. I am outpatient, so I haven't been as immersed as some people like the nurses, which we are super grateful for. It was really challenging. I was on quarantine, obviously, because my husband was sick. And so initially I tried to keep working from home. I was doing telemedicine by phone of unrelated, unrelated things. And my husband was mostly in bed, like Jim. He wasn't really getting out of bed much. And he didn't really seem to need my help because he was basically sleeping. And as probably many people in the caregiving field know, that doctors like to fix things, nurses like to fix things. And I just didn't feel like there was much for me to do. So I tried to work, and then one day I took off my noise cancellation headphones and I heard my husband coughing relentlessly downstairs. And I ran downstairs and he looked horrible. He was pale, he was exhausted. And I just said, I can't believe I'm still working. Like, this is crazy. So I stopped working and I started being more of a full-time caregiver as best I could. Like I said, he slept much of the time, but he probably would have been better off having a nurse, but he was stuck with me. And I think there were some advantages to that, in that he, at his height, was taking almost 40 pills a day. He was on oxygen. He was using a puffer. He took a medicine for nausea and a medicine to protect his stomach. And he took an antibiotic twice a day and prednisone for bronchospasm. And he was just really, really sick. And I can't imagine. Initially, he was just taking those medicines himself. They were by the bedside. But when I realized how sick he was, and I started looking at the medicines, he couldn't remember. Like Jim, he had some fog. I think I took it. I didn't take it. I finally made a spreadsheet. And I thought, wow, for people at home trying to care for their families, it's the supportive treatment, as Claudia knows, the supportive treatment of COVID is exhausting. Basically, you're chasing your symptoms, trying to catch them before they rage out of control. And then you're waiting helplessly for those interventions to work. And my husband was in bed for almost 3 weeks with the temperature of 104, despite taking medication around the clock. So, I think it was helpful for me to be a doctor, but maybe in the beginning it wasn't. And I think it would have been even more helpful if I was a nurse.
Okay. Well, what I'd like to kind of move into is a subject now, because you've referenced communication issues around vaccines, hesitancy, and those kinds of things. And that's really, these days, as I mentioned earlier in the webinar, such a complex and timely issue. So what I'd like to do is, again, show you a video of these people on the panel and some others talking about their thoughts related to vaccines and hesitancy. So we're going to play that video. On the other side, we're going to have them talk a little bit more about that.
There's just a lot of unknowns with the disease, a lot of unknowns with the vaccine, but at least now we have 2, 3 vaccines and maybe more coming that seem to be safe and protective. And we'll just have to continue to watch the science and believe, and trust the science, to be able to keep up with the rapid changes that are occurring with this evolving virus.
I think my experience with Paul has made it much easier for me to realize how scary it is for family members who have people that are very sick with COVID. But the other benefit, I think, is that because it clearly can happen to anyone, I have a good story to tell for people who are hesitant to become vaccinated. I share my story of my husband and how he's basically a healthy person and got really sick unexpectedly, despite us being really careful with COVID.
I spent the day at the clinic doing the vaccinations yesterday, and it was nice to be on the other end of this a little bit, to be there to see how excited people were. So, I mean, we're getting there. It just, not as quickly or not as many as I think we need to.
So now what I like to do is I like to begin with Dr. Baker-Porazinski. And you touched upon it in the video clip, but I'm really interested in hearing more about what happens, having gone through the experience that you had with Paul, when your patients are questioning the vaccine, perhaps for safety reasons, or it could be other things as well. So how do you, again, coming from where you come from, how do you respond to patients who you find are like pushing back on taking care of themselves and others with vaccines?
Well, I start with telling people that, the obvious, the vaccines save lives. And I try to figure out why they don't want to get vaccinated, because there's a lot of myths out there. And if I understand where they're coming from, I'm better able to help them make a good choice, I hope. I respect their decisions. I never try to force anyone to do it. And I don't really use my husband. I try not to use him to scare people, but I just try to say, look, we don't know who it's going to happen to. And the very small chance that you have a reaction to a vaccine is not anything like the big chance that you have a severe case of COVID or you infect somebody that you love. So what I tell people, I tell them a couple things. I say that, the vaccine rate in a community is really the variable that most closely corresponds with hospitalizations and death. So the more people that are vaccinated, the less deaths from COVID. And we obviously see that now in places like India, where the vaccination rates are very low. I also tell people when they're afraid about side effects that could show up later, that almost all side effects from vaccines are in the first 2 weeks, and if not, nearly everyone in the first 2 months. So the rare possibility of a side effect occurring down the road, I think that was a big concern for a lot of people, is because those side effects that may be more scary are really rare, 1 in a million. So you may not pick them up when you're just doing, a 40,000 people test to get it passed. And I just basically say what's really not safe is getting COVID. It's highly contagious. It's killed more than 500,000 people just in the United States. There's long-term complications of the brain fog that Jim mentioned and the exercise capacity, and people die from it. And then I also kind of appeal to people's wanting to be helpful in general. Like, this is your chance to do something good for society. If we don't get most people vaccinated, then we're going to have to wear the masks and we're going to have the hospitalization rates, and it's not going to go away. So to reach herd immunity, we need to have more people vaccinated. And even if you don't think you're going to get it, or you're not really worried about yourself, you're protecting other people. You're protecting grandparents. You're protecting people on chemotherapy that can't get vaccinated. So, and for young people, there's a new variant that's really been found to be highly contagious in young people. So I tell them it can happen to young people, and there are young people that die, and there are young people that are athletes that can no longer do their sports because they have long-term respiratory consequences. So I try to appeal to everyone's general good nature. Like, we want to be helpful, and even if you don't want to take it for yourself, then doing it for other people is a way to be selfless.
Mm. So let me continue with our medical professionals. I'm going to ask Gretchen. See, you, of course, as an ICU nurse, have witnessed people not only very sick, Jim being very sick, but also some who've died.
Mhm.
So I'm just wondering, similar to what Dr. Baker-Porazinski is talking about, how do you respond when you find there are people who are resistant, hesitant, or really push back about doing what is important not only for us, but for others, is taking the vaccine. You just were at the clinic the other day administering vaccine. So how do you deal with that?
Fortunately, I mean, have not come across as many people who are not willing to get vaccinated. And working at the clinic has been pretty rewarding to have so many people come in that want the vaccine. But I have had conversations, and I think that I am in the age group that is the most resistant, it appears. And as they get into the 20, 40-year-olds, I think, Dr. Baker, that's probably the most resistant group right now. Am I right? Yeah. So I have had to have those conversations, and I've been pretty frank with some people that they just don't seem to think that it's going to happen or it's not that bad. But there are some, especially some of my friends, I have been able to convince to be able to get it by telling them it has been some of the situations that I have been in, I would not wish on anyone. I would not wish anyone to have to pick up the phone and call someone's wife or call their daughter and say that we're getting ready to intubate your husband or we're getting ready to intubate your father, and listen to some of those phone calls and be in the room when they say, I'm going to be okay, I'm going to be okay, and know that there's a chance that that may not actually be the outcome, and to have it not be the outcome. And sometimes I think that people have to hear those hard truths. That this is real. It's real here. It's real everywhere. It's not something that's, made up. And so when I'm at the clinic, I am very thankful for everyone that comes in and everyone that gets the vaccine. And I try to make sure to thank them for that, because what they've done, and by getting the vaccine, what they've done is they've decreased the chance of being in that ICU and making that phone call to pretty close to nothing for themselves and for those that are close to them.
And this is why we have you all on the panel. You use the word real, and it's as real as it gets. And I think we get so inundated by the media that we get numb. And what we're talking about, all of you are talking about, really makes it so palpable about what it's really like, whether you're the patient or you're the caregiver, the spouse, or for that matter, you're the healthcare professional. So this is, I think, really important. And now I really want to turn to both Jim and Claudia at this point to really ask you the same question, because this is about communication. That's really what we're talking about now. How do you communicate to people who just have their doubts or have their fears? And so I want to ask you each, or together for that matter, so you can, if you don't mind, Claudia, you can unmute, thank you. In terms of so what do you say to people that you run into who are really, again, resistant, hesitant? How do you approach that, having gone through what you've gone through, both of you?
Mm-hmm. Jimmy, do you want to speak first, or?
Yeah, I need to take 1 second, Claudia, while you speak, to shut the door. Our
Gotcha.
pup came in to visit me and opened the door. I will be right back.
Okay, then I'll speak. Okay, so yes, I have had my 2 vaccines, and I was thrilled to get them. And for others that it's been said before, I will say, do it for yourself to be safe, but it's really, I feel like it's a duty, it's a duty for us. This is a worldwide virus. This is, and we do want to get back to our full lives, we want our full lives back, and that will get us there quicker. So we can get out from behind our masks, and we know that we're safe because, well, I've been vaccinated, so I know the people that I'm still in masks at work. We have to wear them, obviously, and I still take all precautions. I'm still doing that even though I'm vaccinated. But that it helps others, you know, your loved ones, anybody. This spreads like wildfire.
Yeah.
So just to get back to a full life.
Sure, but I want to just now ask you, Jim,
Mhm.
having gone through this, but having not a lot of memory about it, knowing in retrospect probably how dangerous.
Yeah, I mean, I think at BBA, I think I was one of the first adults that had it, I think. And so it was a big deal. And I concur with Claudia, the amount of support we got was incredible. I am a firm believer in science and a firm believer in the medical world. My mom was a nurse. And I mean, for a fleeting moment, I worked as an EMT out in LA. And science is science. And this is happening. This is not a wives' tale. This is like, I didn't sit there and think to myself, ooh, I'm gonna make myself believe that COVID is there so I can get sick and go to, no, that's not what happened. I got chewed up. And I got chewed up, you know, as someone who is used to working 12-hour days, 6 days a week, doing the work that I do, and then to not be able to do that. So I tell people, this is real. You know, this is just like getting, you know, we had measles vaccines, we had, I believe, chickenpox vaccines. We have those. If someone goes overseas, they have to have those shots before they can leave. And like Gretchen, I volunteered at the clinics. And so when I was given the okay to go do that, I used my experience to say thank you to the people and to show the empathy for them. But we did a couple of clinics down in Bennington where we had people who were afraid, and they had gotten some miscommunication, or they had been told by their family they shouldn't do this. And I remember very clearly sitting with a young person and, you know, speaking with them in intake and saying, what are you nervous about? What are you afraid about? And I remember the woman I worked with who was a nurse, and I shared my story. And that young person was like, you know, I'm going to get the vaccine. My whole family doesn't want me to get it, but I need to get it. And I mean, that's how we take care of each other.
Mhm. Yeah.
Right? That's why we drive on the right side of the road, and we wear seatbelts, and we do things so that we as a community can come together and support each other and be there, and take care of each other. Because if not, you know, why do we do this? You know, why do we sit here? So I always ask this. I hope that answers your question.
It does, and because you all are telling stories about what your actual experiences have been. And I imagine, in fact, I kind of know that it's probably the most powerful method of communication. It's, you know, you're not lecturing anybody.
Mhm.
You're sharing what you went through as a way of educating. So really, I thank you for sharing that, and the people who are attending and the people who will be watching the recording afterwards are really going to be able to learn from that.
Mhm.
So let me kind of move on a little bit here. And what I'd like to do at this point is turn to another subject, and that is, we know, and you've really all alluded to it, that from crisis, often there are opportunities, that struggles, positives can come out of that as well. So what I'd like to do is show another short clip where some of you are on there, but we're going to expand on it. And we're going to talk more about how what you've learned from this experience, how it's informed your lives going forward. So let's see that clip, and then we're going to have a chance to talk more about that.
It's taught me a lot about what really is important and what really does matter.
Having this experience has made me personally have to step back, take some breaths, slow the roll, kind of get a reset, and even more than ever, make true human connections with people.
I think this gave me and probably a lot of other people the opportunity to really appreciate everything I have and all the blessings I have.
So we've just heard very brief comments by the members of the panel here, but I think it'd really be worthwhile because this is such a impactful experience to be able to talk about. Again, I use the term lessons learned, but it's beyond that. It's really like what kind of positives have come out of this kind of experience for each of you. And what I'd like to do is, I think I'm going to begin with you, Gretchen. You started off the video talking about some of this, and could you kind of elaborate a little bit more about what you've learned, what's come of this?
Well, I think COVID probably for a lot of us has definitely humbled many of us. And it's, reminded a lot of us what does really matter there. As everyone in healthcare knows or has, there's always these patients that we remember. And I'm very good at remembering when I see patients on the street, I don't always remember their name, but I know that I've taken care of them and I always can remember them. And a lot of times their families, but there is a group of patients that now their names are etched in my mind and I won't forget them and I won't forget their faces ever because of COVID. And it just, like I said, it humbles you a lot and it reminds you of everything the little things that really matter. Like my 8-year-old, she's very upset because she's had to have 2 COVID birthdays in the last 2 years, but she finally was able to have a little bit of a party this year, and her party day fell on the day that my father was fully vaccinated. And so it was just something as simple as I can actually give my dad a hug and I could tell my daughter, Emma, you can go give Bubba a hug today. It like something so simple now means something so much. And I think there's a million other examples of that, but yeah, it just little things are now huge things for I think so many of us. And COVID has taught us in medicine and in real life, not to give up. We have come so far in the last year. We still have a long ways to go, but I think for a lot of us, we know that we're going to get there. It's just we can't give up in the process.
So I'd like to ask you, Jim, really the same question in terms of what is it that the positives, what is it that has come from this really incredible experience, life and probably life altering?
Well, I get to see my wife every day, so that's like freaking awesome. We get caught up in a rat race. We get caught up working. We do what we do. With the kids I work at school, I'm like, remember, you're storytellers. That's what it is to be an actor, to take someone else's life and infuse life into it so that you can, affect an audience and educate them and maybe open up conversations with them. Having COVID has, yes, slowed, as I said, slowed the roll down. And what I mean by that is it's just like, it's okay now, relax. Take some time. Go outside. Something happens. We don't have to rush to the finish line. Find that balance. I mean, that is what Claudia and I talk about quite frequently, has been refining the balance. Mm-hmm. I guess, a personality. I want to go out and I want to accomplish it yesterday, and then I'm going to continue pushing forward and pushing forward. You know, COVID does what working with the students at school do, is it teaches me how to be human. And that's really important. And I think, again, I deal, and so Claudia deals with, we're dealing with high schoolers who are dealing with COVID, and we're dealing with their fear and their parents' fear and or whatever their belief is of it. And we're dealing with some of their emotional thoughts on it and how they're dealing with it. And you really have to now totally sit there and make a true human connection. And if you don't make the human connection and you miss it, boy, are you missing an opportunity to be affected by someone and to hopefully affect someone in a positive way. So that, I mean, there are many other things, but that really, those are the positive things for me. And to now not take for granted breathing and being able to, you know, take a walk and being able to just be in the moment.
Yeah, good. I want to ask you, Claudia. So for you, what has come of this? You know, lessons learned.
Similar things to Jimmy. I was really surprised, I guess, because we've never really been in the situation where we need help in that way. And, you know, people like the country store called us and asked us what we needed down at the bottom. You know, that's our little community down there. People from school were dropping things off. They were bringing things over. Many people, they were texting and calling and this and filling in and helping out and, you know, picking up, you know, things that we usually do. And everybody just came together, and it was just the community, the medical community. Everybody was just so happy to help and to be there and to be of service. And wow, it was humbling. And finding the balance was beautiful, and spending more time with my husband, obviously after, you know, he was in recovery from COVID. But really, and you know, thank God for the internet, what we're doing now to get messages out, obviously. But I want to see people's faces again. I can't wait to see their faces, right? The hugs and, you know, all the things that, you know, those connections, you know, hugs, and to see groups together. And, oh, I just can't wait to just see just all the human connections again. Just, you know, we've just been eyes, you know, smiles. I miss the smiles. And
what you're saying, because it's something everyone's saying, and Jim also just said it, is, you know, what we all take for granted, and you go through this experience and like, no, you don't take breathing for granted, going for a walk, any of these kinds of things that this is, again, something that's come out of this. I'd like to turn now to Dr. Baker-Porazinski and ask you the same thing in terms of the positives that you, and for that matter, Paul, your husband, have experienced.
So I would be remiss if I also didn't start with gratitude, extreme gratitude that we experienced towards the healthcare community that kind of rallied around us, our friends and neighbors who brought us food. I mean, when you're put on quarantine, suddenly you don't get to check if you have milk and toilet paper. So we had neighbors that just dropped those things off without even asking, that made meals, that brought things over, that texted, that called, that checked on us. I'm grateful for as I mentioned, the healthcare community. I have a sister that's a nurse that works in the hospital, and she is taking care of COVID patients every day. I'm grateful for my work, because when I said to them, I can't do this, they were like, okay, fine, we'll figure something out. So that's kind of my personal input. But in terms of my patients, self-care, stress reduction, mindfulness, these are things I feel like I lecture people about every day. They're probably tired of hearing about it from me. And I think COVID has given us an opportunity to slow down the frenetic pace of life. My calendar went from having 8 things on it a day to having nothing, and I love it. I'm so excited when I have nothing going on for the weekend. And I think a lot of people really appreciate that. But people are more mindful because they're paying closer attention to what they touch and what their immediate environment is and who they're around. People are connecting with loved ones, even if it's virtually. They're calling people because they realize how much they miss that human connection. Jim mentioned people are going outdoors. They're just tired of being stuck inside. So people are going out into nature. These are all things that are going to help your life in the long run. These are all things that help people live longer. Gratitude, mindfulness, taking care of yourself, going outside, connecting with people. I mean, I couldn't give a better prescription for wellness. But the one other thing I would point out, and I really hope that this is true, is I think everybody's aware of the disproportionate impact that COVID has had on people of color and other racial groups. And so I am so hopeful. You had mentioned, Bernie, about crisis being an opportunity. I am really hopeful that this will be the time that America wakes up to the need for equality, tolerance, and compassion, as well as inclusion of everyone in healthcare. I really believe that healthcare is a right and should be a right of all Americans and not just a privilege for those that can afford it.
Well, thank you, all of you, for sharing with that. Well, I'm aware of the time and I want to be able to take some questions that have come in. So I'm going to begin with one question that came in with the registration. And here's the question. How can healthcare providers recognize the psychosocial stressors on patients with long COVID in terms of job performance, caregiving, and so on? How can we ensure that these are seen and addressed, the psychosocial effects of living through this time of COVID? So I'll kind of toss it out there. If anyone would like to respond to that, please do. How do we do that?
I think that's a benefit of being in family practice, is that hopefully we know our patients, and not only do we know our patients, but we know their spouses and we know their grandkids in North Carolina because they show us pictures, and we know what their support systems are. So hopefully we know when people are already struggling and need our help. I think I'm really lucky to work at a place where I have a care coordinator. There's transitional nurses at the hospital. So there are people that when I don't know how to help somebody, I can reach out and say, I think this person needs help. I think they need food. I don't think they can get to the doctor's appointment. I think, they need somebody to take care of their kids or to pick them up. And we come together as a community to try to help. I guess that's what I would say. I think it helps a lot to have a primary care person and the nurses in my office too. They often know a lot more about the families than I do, and they'll share with me when somebody is struggling and needs help.
Yeah, I think another piece to this is really, as you as a physician or nurses, people in healthcare, really encouraging and giving people permission to talk about, back to the question about psychosocial stressors, to really recognize that they're important and they need to be addressed because everyone is going through it and in one way or another is impacted on in those areas. So anyone else would like to respond to dealing with the psychosocial stressors, or should we go on to another question? Okay, another one. Yeah, let me this just came in. Well, this is actually for Gretchen, and it's how do you view the difficulty of communication between the ICU of ventilated patients and their families who couldn't be with them. How do you touched upon that a little bit, but how do you view that as a real challenge?
Yeah.
Mission.
I mean, I think it's a huge challenge that we've gotten a little bit better with maybe over the last year as COVID's been going on, especially, again, like I kind of touched on earlier, prior when families could come in and you could explain the ventilating to them and you could show them the vent and they could see their patient or their family and their loved ones, it was easier. So now you're trying to do that over the phone. And you have to, and families know like a wide range of things. I know what they've heard on the media, some when you're dealing with other family members in healthcare or people that know very little about healthcare, you just have to find that common, I don't want to use the word sweet spot, but something where you can resonate with them so that they can understand what you're saying in a way that doesn't sound overwhelming or too scary, because it is so scary, especially when you can't see it. And I think we've gotten better at that, but it certainly is a challenge. And again, that just sometimes is just realizing that there might be a piece of the care or the venting that they may understand, and that might be all that they're able to focus on. And so you focus on that as well, and you find the positives in that. And you've got to find a way so that when families hang up the phone, they still have some hope going, because I remember that from the first wife that I had to talk to. She's like, I'm just so, you could just hear it in her voice. And I cannot imagine what Claudia was going through on the other end of the phone every day. And you get 6 minutes of information throughout the day. And so you've got to find that niche so that while Jim's trying to breathe in the hospital, you need Claudia to be able to breathe at home as well.
Really well put. Just aware of time, and I think we only have a few minutes. And there are more questions, so I don't know whether we can squeeze one more in before we kind of try to wrap things up. And the question is for Jim. What are you doing to move past the experience of COVID physically, emotionally, intellectually?
Well, intellectually would mean that I'm smart, and I'm probably not that smart. So we'll go to the other two. Physically, honestly, I just try to get back to working out and trying to get back to getting where I feel comfortable and strong. And it's going to be different than what it used to be. But to just be safe about that. I do a lot of when I'm talking to people, I have to really take my time now, and I ask, does this make sense? Because there were times when I'd be like, what did I just say to you? And they'd be like, Jim, and I'd be like, okay, does this make sense? So I'm just trying to stay present and in the moment. I think one of the big things, and I've never been afraid of this, is that I don't have a problem talking about my experiences, both positive and negative. That's what makes us human. And I just try to be honest. I mean, it's hard. I try to share, yeah, it was kind of scary. Do I remember it? Not much, but the ramifications are pretty severe. And I think the big reason how I'm handling it is the support I get from the community at BBA and here. I mean, Claudia and I always laugh, and I always tell the students I work with, hey, when you do a show, it's great. You get a family. It's wonderful, right? You get to go in, you get to make stuff together, and it's all fun, and it's this and that. And whether any of us like it or not, we are all part of a community in some way, shape, or form. And hopefully that community will understand when you need that help to get back intellectually and psychologically and all of that. And, you know, I feel that I'm doing that with the support of the people I work with at school, with my family, with my wife, and just with the people I volunteer with. It's just kind of going out and making those connections.
How more important than ever. It sounds
Yeah.
like. Yeah.
Yeah.
So now we're really just about out of time. So I want to just take this moment to thank our amazing panel. Really, thank you so much, Jim and Claudia, Gretchen, and Jennifer Baker-Porazinski, of course. Now, programs like this, as you probably imagine, take support and sponsorship. And I want to just take a moment and acknowledge the sponsors for this really superb program. And these are the folks who really help make this happen. We can't do this on our own. And if any of you out there want to support our work, please go to our website, speaksooner.org, and you can donate if you'd like. And certainly we hope this has been informative. I know it's been informative to me. We're going to be sending all the attendees an email, and there's a survey, and we really do appreciate your feedback and suggestions. And also, if you want to know more about our work and you want to sign up for to learn about upcoming programs, go to speaksooner.org. Also a pitch for, at the website, there's a free access to a guide for difficult conversations. It's there, and Celia's blog is there, Medical Humanist Notes. And if you want to contact us, of course, you can contact us at speaksooner.org. Everyone who is attending will get a link to the recording. And so everyone knows that if you know someone who was not able to make it, or you think would really benefit from viewing this webinar, tomorrow evening, again at the website, speaksooner.org, it will be up, and it will stay up so that anyone else can actually get the benefit of hearing what you all had to say. And just in closing, I mean, so much of what we do at the Center for Communication and Medicine is about improving healthcare communication and trying to help people make informed decisions about care. And we also, in all of our programs, talk about that healthcare providers, as you know, healthcare providers are not mind readers. And that we emphasize that we as patients, and I alluded to this earlier, that we have to be ones to open up channels of communication, to ask our questions, to express our concerns, not just only about COVID, but about other illnesses that we may be experiencing. So in closing, good communication is good medicine. And I really thank you all for attending. And again, thank the panel so much for your wisdom. I hope to see you all again. Stay tuned. And if you want to learn more about what we're doing, please visit speaksooner.org.